Carbinoxamine is a first-generation antihistamine used to treat allergic rhinitis, vasomotor rhinitis, allergic conjunctivitis, allergic reactions, and mild allergic reactions. In this video, let's find. What is carbinoxamine? What is carbinoxamine used for? Contraindication. What are the side effects of taking carbinoxamine? How does carbinoxamine work? How to use carbinoxamine? What is carbinoxamine? Carbinoxamine is an antihistamine and anticholinergic agent. It is used for hay fever, vasomotor rhinitis, mild urticaria, angioedema, dermatographism and allergic conjunctivitis. Carbinoxamine is a histamine antagonist, specifically an H1 antagonist. It was patented in 1947 and came into medical use in 1953. It was first launched in the United States by the McNeil Corporation under the brand name Clistin. Carbinoxamine is available in various countries around the world by itself, combined with decongestants such as pseudoephedrine, also with other ingredients including paracetamol, aspirin, and codeine. What is carbinoxamine used for? For symptomatic relief of seasonal and perennial allergic rhinitis and vasomotor rhinitis, as well as allergic conjunctivitis caused by foods and inhaled allergens. Also for the relief of allergic reactions to blood or plasma, and the symptomatic management of mild, uncomplicated allergic skin manifestations of urticaria and angioedema. Contraindication. Carbinoxamine maleate is contraindicated in children younger than 2 years of age. Carbinoxamine maleate is contraindicated in nursing mothers. Carbinoxamine maleate is contraindicated in patients who are hypersensitive to the drug or on monoamine oxidase inhibitor therapy. Side effects. Continuous and/or cumulative use of anticholinergic medication, including first-generation antihistamines, is associated with a higher risk of cognitive decline and dementia in older people. Pharmacodynamic. Carbinoxamine is a first-generation antihistamine of the ethanolamine class. Ethanolamine antihistamines have significant antimuscarinic activity and produce marked sedation in most patients. In addition to the usual allergic symptoms, the drug also treats irritant cough and vomiting and vertigo associated with motion sickness. It also is used commonly to treat drug-induced extrapyramidal symptoms as well as to treat mild cases of Parkinson's disease. Rather than preventing the release of histamine, as do cromolyn and netocromil, carbinoxamine competes with free histamine at HA receptor sites. Carbinoxamine competitively antagonizes the effects of histamine on HA receptors in the GI tract, uterus, large blood vessels, and bronchial muscle. Ethanolamine derivatives have greater anticholinergic activity than do other antihistamines, which probably accounts for antidyskinetic action of carbinoxamine. Mechanism of action. Carbinoxamine competes with free histamine for binding at HA receptor sites. This antagonizes the effects of histamine on HA receptors, leading to a reduction of the negative symptoms brought on by histamine HA receptor binding. Carbinoxamine's anticholinergic action appears to be due to a central antimuscarinic effect, which also may be responsible for its antiemetic effects, although the exact mechanism is unknown. Half-life: 10 to 20 hours. Dose: for treatment of allergies. For oral dosage form, extended release suspension. Adults and children 12 years of age and older, 6 to 16 mg, mg, or 7.5 to 20 ml, ml, every 12 hours. Children 6 to 11 of age, dose is based on body weight and must be determined by your doctor. The dose is usually 6 to 12 mg or 7.5 to 15 ml every 12 hours. Children 4 to 5 years of age, dose is based on body weight and must be determined by your doctor. The dose is 3 to 8 mg or 3.75 to 10 ml every 12 hours. Children 2 to 3 years of age, dose is based on body weight and must be determined by your doctor. The dose is usually 3 to 4 mg or 3.75 to 5 ml every 12 hours. Children young 2 years of age, use is not recommended. For oral dosage form, solution. Adults and children 12 years of age and older, 4 to 8 mg, mg, 1 or 2 teaspoonfuls, 3 to 4 times a day. Children 6 to 11 years of age, 2 to 4 mg, 1/2 teaspoonful, 3 to 4 times a day. Children 2 to 5 years of age, dose is based on body weight and must be determined by your doctor. The dose is usually 1 to 2 mg, 1/4 to 1/2 teaspoonful, 3 to 4 times a day. Children younger than 2 years of age, use is not recommended. For oral dosage form, tablets. Adults and children 12 years of age and older, 4 to 8 mg, mg, 1 or 2 tablets, 3 to 4 times a day. Children 6 to 11 years of age, 2 to 4 mg, 1/2 to 1 tablet, 3 to 4 times a day. Children younger than 2 years of age, use is not recommended. Safety advice. Carbinoxamine has been assigned to pregnancy category C by the FDA. Animal studies have not been reported. There are no controlled data in human pregnancy. Carbinoxamine is only recommended for use during pregnancy when benefit outweighs risk. That's all the information about carbinoxamine we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.